Your body has been trying to warn you for months, maybe even years, and you've been calling it just getting older. That fatigue that hits you by mid-afternoon. That thirst that no amount of water seems to satisfy. That blurry moment when you look at your phone screen and have to blink twice before the letters come into focus. None of that is aging. According to the Centers for Disease Control and Prevention, more than 38 million Americans are living with diabetes, and roughly 1 in 5 of them don't even know it. After the age of 50, the risk climbs sharply, and the warning signs become easier to dismiss precisely because they overlap with everything we've been told to expect from growing older. This is where the danger lives, not in the disease itself, but in the silence surrounding it. Doctors who specialize in endocrinology will tell you that high blood sugar, left unchecked, doesn't announce itself with a single dramatic moment. It creeps. It settles into the body quietly, reshaping blood vessels, nerves, and organs long before a person ever steps into a clinic for a fasting glucose test. The American Diabetes Association has spent decades educating the public on exactly this problem, that the early signs of elevated blood sugar are so ordinary, so easy to explain away, that most people only get diagnosed after the damage has already begun. Researchers writing in the journal Diabetes Care have noted that people often live with undiagnosed type 2 diabetes for years before symptoms prompt a doctor's visit. Today, we're going to walk through 7 of those signs, the ones your body may already be showing you. And when we reach number 5, pay close attention, because it's the one most people override without a second thought, and it's often the first sign something is seriously wrong. The first sign is thirst that never seems to end. Not the ordinary thirst after a walk in the sun, but a persistent, almost desperate need for water that follows you through the day and into the night. This happens because when there's too much glucose circulating in the bloodstream, the kidneys go into overdrive trying to filter and absorb the excess sugar. When they can't keep up, that sugar spills into the urine, pulling fluids from the body's tissues along with it. The result is a dehydration cycle that no amount of drinking seems to fix. Many people in their 50s and 60s chalk this up to dry air, medication side effects, or simply drinking too much coffee. But if the thirst is relentless and paired with a dry mouth that won't go away, it deserves real attention, not a shrug. Physicians often describe this symptom as easy to underestimate because it hides behind daily habits, until the pattern becomes impossible to explain away. The second sign follows naturally from the first, frequent urination, especially at night. Waking up 2, 3, even 4 times to use the bathroom isn't a normal part of aging, though it's often treated that way, particularly in men who assume it's related to prostate changes. While that can certainly be a factor, elevated blood sugar is one of the most overlooked causes of nighttime urination in people over 50. The kidneys are working overtime, and sleep pays the price. Chronic sleep disruption from this cycle doesn't just leave you tired. It actually worsens insulin resistance, creating a loop that makes the underlying problem harder to control. Sleep researchers note this cycle becomes self-reinforcing. Poor sleep raises cortisol, which raises blood sugar further, deepening the very disruption that caused the sleeplessness in the first place. The third warning sign is fatigue that sleep doesn't fix. This is different from the tiredness that comes after a long day. This is a bone-deep exhaustion that persists even after 8 hours in bed, a heaviness that makes ordinary tasks, climbing stairs, carrying groceries, finishing a conversation, feel disproportionately difficult. When blood sugar is too high, the body cells are essentially starving in the middle of plenty. Glucose is present in the bloodstream, but without enough functioning insulin to usher it into the cells, that energy never reaches where it's needed. The result is a strange paradox: too much sugar, too little fuel. People often attribute this fatigue to stress, to poor sleep, to simply not being as young as they used to be. But persistent, unexplained exhaustion after 50 is one of the clearest signals that something metabolic deserves investigation. Endocrinologists say this is often the first thing patients describe when they finally seek help, phrased almost apologetically, as though tiredness were too ordinary to matter. It matters more than most realize. The fourth sign is blurred or fluctuating vision. This one frightens people the most, and rightfully so, but it's also one of the most common early indicators of elevated blood sugar. High glucose levels cause the lens of the eye to swell and change shape, which distorts how light is focused on the retina. Vision can blur, sharpen, then blur again over the course of a single day, particularly after meals. Many people over 50 assume this is simply the natural decline that comes with age, the need for reading glasses, the slow deterioration everyone expects. But rapid, fluctuating changes in vision, especially when paired with any of the other signs on this list, are a signal worth taking seriously. Left unmanaged over years, elevated blood sugar can lead to diabetic retinopathy, a leading cause of vision loss in adults, according to the National Eye Institute. What makes this sign worth noting is its inconsistency. Vision that changes from morning to evening is rarely explained by ordinary age-related decline, which tends to progress slowly rather than fluctuate day to day. Now we arrive at the fifth sign, the one we asked you not to ignore. It's tingling, numbness, or a burning sensation in the hands and feet. This symptom is often the most quietly devastating because by the time it appears, it usually means elevated blood sugar has already been affecting the body for a meaningful stretch of time. This is called peripheral neuropathy, and it happens when prolonged high glucose levels damage the small nerves, particularly in the extremities, where blood flow is already working against gravity and distance from the heart. It might start as a strange tingling in the toes at night, or a numbness in the fingertips that makes it hard to feel the texture of a coin or a button. Many people over 50 attribute this to poor circulation, to sitting too long, to old injuries resurfacing. But nerve damage from elevated blood sugar is progressive. It does not reverse on its own, and if ignored, it can advance to the point where injuries to the feet go unnoticed entirely, leading to infections and, in severe cases, amputation. This is why medical professionals consider it one of the most urgent signs to act on, not because it's dramatic in the moment, but because of what it represents happening beneath the surface, silently, for months or years beforehand. Podiatrists who treat long-standing diabetes patients often say the same thing. By the time numbness is noticeable enough to mention, the nerves involved have usually sustained real, measurable damage. That is why this particular sign carries more weight than almost any other on this list. It is a message from the body that time has already been spent, and that the window for easy reversal may be narrowing. The sixth sign is slow healing cuts, bruises, or sores. A small nick from a kitchen knife that should heal in days lingers for weeks. A bruise that seems to take forever to fade. This happens for two connected reasons. High blood sugar damages blood vessels over time, reducing circulation to the skin and slowing the delivery of the oxygen and nutrients needed for repair. It also impairs the function of white blood cells, weakening the body's ability to fight off the bacteria that would otherwise be cleared quickly from a wound. For people over 50, whose skin and circulation are already naturally changing with age, this sign is particularly easy to miss. But wounds that heal unusually slowly, especially on the feet and lower legs, are one of the clearest physical signs that blood sugar levels have been elevated for some time. Wound care specialists describe this as one of the most visible yet most ignored symptoms, because a slow healing cut rarely causes pain severe enough to prompt an urgent visit. It simply lingers until it becomes something more serious. The seventh and final sign is unexplained weight loss, despite eating normally or even eating more than usual. This might seem counterintuitive. How can too much sugar in the blood lead to weight loss? But remember what we discussed with fatigue. When cells can't access the glucose in the bloodstream, the body begins breaking down muscle and fat for energy instead. This creates a strange and unsettling pattern where a person eats the same as always or even feels hungrier than usual, and yet the number on the scale keeps dropping. For people over 50, unexplained weight loss is often mistakenly celebrated, especially if weight has been a long-standing concern. But sudden unintentional weight loss, without a change in diet or activity, is a signal the body sends when something significant is happening internally, and it deserves a conversation with a doctor, not congratulations. Nutritionists who work with older adults say this is one of the hardest signs to communicate, because a compliment can accidentally mask a symptom that should have triggered concern instead of praise. What makes these 7 signs so dangerous isn't any one of them in isolation. It's the way they layer on top of each other quietly over months and years, each one explained away by something more comfortable to believe. Aging, stress, a bad night's sleep, a demanding week at work. And in that explaining away, in that very human instinct to avoid alarm, the real story gets missed. Public health researchers describe this as one of the most consistent patterns in adults over 50, a slow accumulation of small dismissals that adds up to a diagnosis arriving later than it should have. The good news, truly, is that elevated blood sugar after 50 is often manageable, sometimes even reversible in its earlier stages, through changes in diet, movement, sleep, and medical guidance. The Mayo Clinic and countless endocrinologists around the world emphasize the same message again and again. Early detection changes everything. A simple blood test, something as routine as a finger prick or a lab draw during an annual physical, can reveal in minutes what the body has been trying to say for years. Lifestyle researchers have found that modest changes, a daily walk, less refined sugar, more consistent sleep, can improve insulin sensitivity within weeks, long before intensive medical intervention becomes necessary. There is something deeply human about the way we ignore our own bodies. We are taught, subtly and not so subtly, to push through discomfort, to treat fatigue as weakness, to treat thirst and tingling and slow healing wounds as small inconveniences unworthy of a doctor's time. But the body does not measure inconvenience. It measures damage quietly, cell by cell, year by year. And the years after 50 are not years to spend explaining away warning signs. They are years worth protecting, worth listening to, worth showing up for with the same seriousness we would offer anyone else we loved. If any of these 7 signs sounded familiar as you listened, the thirst, the fatigue, the tingling in your feet, the wounds that won't quite close, let this be the moment you stop explaining it away. Not out of fear, but out of respect for the years ahead of you, the ones worth protecting. Talk to your doctor. Ask for the test. Because the body rarely lies, and after 50, listening to it closely isn't weakness, it's wisdom.